Today's training is all about knowing the signs and recognizing the early signs and symptoms of your patients. Some of the key points, we're going to go over some warning signs, red flags and what to look for, general warnings, and when to seek help. So, did you know that nearly 80% of chronic disease complications could be reduced or prevented with early detection and intervention? Delayed recognition of sepsis leads to mortality rate of up to 50%, according to an article by the CDC. And in long-term care settings, missed early signs of infection are one of the top reasons for ER visits and hospitalizations. So why does early recognition matters? So I know it's important to listen to our bodies, and it's also important to make sure that we tell this to our patients. We want to encourage them to listen to their bodies because they know what's going on with them firsthand better than a lot of times better than us as healthcare workers do. But early intervention, especially in older patients, can lead to a numerous of great outcomes. By prioritizing early detection, we can make sure we have a plan that's tailored to that specific patient, and then us as healthcare workers and the facilities can effectively manage the needs of those patients. For example, some conditions may be treatable. For instance, like vitamin deficiencies, sleep disorders, depression. Those conditions can lead to the patient having dementia-like symptoms. So we want to make sure we catch those things early. Some of those general signs of illness would be fever and chills, unexplained weight loss or fatigue, persistent cough, shortness of breath, nausea, vomiting, diarrhea that won't go away, pain that is new, severe, or worsening. So anything that's acute. Now, if they've been dealing with something for a long time, they may already have a diagnosis for it or taking medication. But if it's something that's new that they're complaining, something that's acute, we want to make sure we pay attention to those signs because we don't want that to develop into something that we could have prevented. So for a stroke, symptoms of a stroke depend on what area of the brain is affected. So for this, you can look for signs of slurred speech, difficulty speaking. You might see one side of the face drooping. You might get weakness of the arms or legs, one-sided numbness in the face or somewhere on the body. And then you have the heart attack, which is a blood clot in the heart. You might experience chest pain, left arm pain. You might have some trouble breathing. And this one is just another example what to look for in PE and a DVT. Just coughing up blood, trouble breathing. They might experience redness or discoloration of the skin. That's another thing you want to pay attention to, especially in our elderly patients. You want to make sure you're checking their skin integrity all the time, looking for discolorations or anything outside of the norm. Another most common condition in the elderly is the warning signs of a UTI. This one is very one of the lesser known symptoms in the elderly. So a lot of times you'll see them experience dementia or Alzheimer's like symptoms. The elderly can struggle to communicate discomfort due to suffering from these conditions, but sometimes it could be that they have a UTI. It doesn't necessarily mean that they have dementia or they have Alzheimer's. They can experience hallucinations and agitation, cloudy urine. So in the elderly, the first thing we check for if they are agitated, they're having hallucinations and it seems like they're forgetful, the first thing that we want to think about is checking their urine just to make sure that they don't have a urinary tract infection. Let's do a quick review with this case study. So Ms. Jones, 82, has been more confused than usual. Not eating well and seems more sleepy throughout the day. Her caregiver notices her urine has a strong odor. She has no fever. What is the possible concern? And the answer would be B, a UTI. Older adults often show confusion or changes in behavior as the first sign of infection, even without fever. Some red flags that you should never ignore would be sudden confusion, slurred speech. Anything could be going on with this. It could be signs of a stroke, chest pain or pressure, difficulty breathing, new or worsening swelling, severe headache, high fever that accompanies a rash. We want to make sure we are describing these symptoms clearly. So a method that I like to use is the old CART method. The O would be for the onset, so you want to know, when did the symptoms start? Location, L will be location. Where is the symptom located? D is duration. How long does it last? Is it constant or comes and goes? The C, characteristics. What does it feel like? Is it sharp? Is it dull? Is it a burning or tingling sensation, etc.? The A is aggravating or alleviating factors. So what makes it worse, or is there anything that make it better? Radiation. Does the pain or the symptom move to other areas? And then the T for treatment. What has been tried and did it help? Why does this matter? Accurate symptom description helps healthcare providers make the right diagnosis faster. Common reasons caregivers miss those warning signs: assuming symptoms are just part of aging. And I see this done a lot, especially in the elderly community, also with small children. You think that because they're complaining about something that is part of aging, or that's just him or that's just her, they just do that. Lack of training on subtle signs, especially in elderly or nonverbal patients, not knowing when a symptom is urgent, overlooking changes in behavior or mood as medical signs, failure to report minor issues early, fatigue or burnout reducing attentiveness. Remember, small changes can indicate serious problems, so we want to make sure we pay attention to those signs. So let's look at emergency versus non-emergency symptoms. When to call 911 or go to the emergency room, and versus when to notify the nurse or monitor closely. So chest pain or severe chest discomfort, you want to make sure that you pay close attention to those. Those are signs that would be a call to your provider or a call to get them to the emergency room. They're having mild headache without any other symptoms. Okay, just monitor it closely. Notify the nurse. Difficulty breathing or bluish lips. Okay, difficulty breathing, that tells you that there's some kind of blockage somewhere, some circulation or something is being cut off or something. That's definitely a trip to the emergency room. They're running a low grade temp. there's no rash or anything, any other accompanying signs, you want to make sure you just monitor that closely. Sudden weakness, numbness on one side, emergency room. Minor cough or congestion, okay, we're just going to monitor that. Uncontrolled bleeding, okay, that definitely warrants a trip to the emergency room. Occasional dizziness, something that's already evaluated, just monitor it closely. Severe confusion or loss of consciousness, definitely emergency room. Change in appetite or mild fatigue, you just want to monitor that closely. When in doubt, you're going to always escalate your concern to the healthcare team or your healthcare provider. So your role as the caregiver is to advocate, observe, and report. So you want to advocate, speak up for those patients. They may not always recognize their own symptoms, but let's say you've been with this patient day in and day out, and you start to notice something, make sure you're speaking up for them. Observe. You want to notice any small change. Eating patterns, mood, skin discoloration. If they look like they're breathing funny, you want to make sure you pay attention to that. Report. Use clear, timely communication to share what you see with the nurse or the providers. Make sure you know the who, what, when, the location, when did it start, what did you take, what makes it worse. Make sure you know those things. And document. Write down what you observe, including the times and any changes. You are the eyes and the ears of the healthcare team. Your role is very, very, very critical in keeping patients safe. This concludes our training. Until next time.